Buoy Health Insights, Elbow Injury. Hello, and welcome to another episode of Buoy Health Insights, where we delve into common health concerns and provide you with the knowledge you need to better understand your symptoms. In today's video, we're focusing on elbow injuries, their potential causes, symptoms, and when it's time to seek medical care. If you find this video helpful, don't forget to like and subscribe to our channel for more informative health content. What is an elbow injury? Well, elbow injuries can occur from a direct trauma, such as falling onto your elbow or outstretched arm, or from being hit in the arm. But that's not the only way they can happen. If you're someone who engages in activities with repetitive arm movements, like playing golf or tennis, or jobs such as painting or working on an assembly line, then you might also be at risk for injuring your elbow through repetitive use. A key thing to remember is that the muscles and tendons that move your wrist start at the elbow. So sometimes, wrist pain can be rooted in an elbow injury. Now let's talk about what it feels like to have an elbow injury. If you've experienced a traumatic elbow injury, you'll likely encounter intense pain right away, making it difficult to move your elbow. In some cases, the elbow may even appear deformed or out of place. For less severe injuries, you might feel a deep ache or pain when pressure is applied, and you may have some movement in the elbow, but not be able to fully straighten or bend it. Bruising or swelling often accompanies an elbow injury, although it may not appear immediately. Repetitive stress injuries to the elbow often cause an aching pain, tenderness, and can make movements like bending or straightening the wrist more painful. Whether on the inside or outside, the elbow may be swollen, sore to the touch, and actions such as lifting objects or turning a doorknob could exacerbate the pain. In some cases, you may also feel weakness or pain in your wrist when lifting objects. So, what should you do next? If you've had a traumatic elbow injury, you should head to an urgent care center or the emergency room right away, especially if you can't move your elbow without severe pain or it looks deformed. In such cases, you will likely need an X-ray to assess the extent of the injury, like a broken bone or dislocation. For less severe or repetitive stress injuries, you might be able to manage with at-home treatment, but if the pain persists, a visit to the doctor is essential. Let us now discuss the potential causes, as well as additional symptoms that might indicate specific elbow injuries. Broken elbow occurs typically from a fall directly on the elbow or arm. It can lead to severe and immediate pain, swelling, limited motion, and in some cases, deformity of the elbow. Older people, especially those with osteoporosis, are at a higher risk for elbow fractures from falls. Elbow dislocation. This is when the bones in the elbow joint become partially or completely separated, usually due to falling on an outstretched arm. Symptoms include severe pain, inability to move the elbow, forearm, or wrist pain, numbness, tingling in the fingers, and deformity. Elbow ligament tear. This injury mainly involves the tearing of the ulnar collateral ligament, commonly associated with falls, elbow fractures, and repetitive stress in sports like baseball pitching. Signs include pain on the inside of the elbow, a feeling of instability, and sometimes numbness or tingling in the fingers. Tennis elbow and golfer's elbow. These injuries are due to repetitive wrist movements, causing stress on the tendons either on the outside, tennis elbow, or inside, golfer's elbow, of the elbow. Symptoms include dull, aching pain in the affected area, weakness in the wrist and forearm, and pain during specific actions like gripping or turning objects. So, when should you definitely seek medical care? If you experience any of the following: inability to move your elbow, severe pain, a visibly out of place or deformed elbow, significant swelling, or if you suspect a severe ligament tear, it's crucial to get immediate medical attention. Treatment might range from wearing a sling or splint, taking anti-inflammatory medications, to possibly requiring surgery depending on the injury's severity. As you take these steps towards your recovery, it's important to discuss your injury's prognosis with your doctor to understand the healing timeline and reduce any frustration that might come with the recovery process. Remember, always consult a healthcare professional for a diagnosis and treatment plan that is tailored to your specific condition. Online tools such as symptom checkers can provide a self-assessment, but they should not be used as a substitute for professional medical advice. That's it for this episode of Buoy Health Insights. If you enjoyed the information, please like this video and subscribe to our channel for more health insights. Stay healthy and see you in the next video.